Individuals sharpen their skills, explore new possibilities, and prepare for the future. More than just an association, IIPA is a thriving community built on collaboration, continuous learning, and collective progress. We are committed to empowering individuals with the right knowledge and resources, encouraging collaboration among diverse talents and experiences, promoting continuous growth in an evolving global landscape. By bringing together the strength, experience, and potential of Indian professionals worldwide, we aim to create lasting impact that goes beyond borders. Together we learn. Together we grow. Together we lead. Join us in building a stronger, smarter, and more connected professional community for generations to come. In a rapidly changing world filled with new opportunities and challenges, one platform is bringing Indian professionals together to learn, grow, and succeed globally. Welcome to the International Indian Professionals Association, IIPA, a dynamic network dedicated to connecting and empowering Indian professionals across the world. At IIPA, we believe success becomes more meaningful when knowledge is shared and communities grow together. Our mission is to support professionals, students, and job seekers by creating opportunities for learning, mentorship, networking, and career development. Through impactful workshops, expert-led seminars, career guidance programs, and professional networking initiatives, IIPA helps individuals sharpen their skills, explore new possibilities, and prepare for the future. More than just an association, IIPA is a thriving community built on collaboration, continuous learning, and collective progress. We are committed to empowering individuals with the right knowledge and resources, encouraging collaboration among diverse talents and experiences, promoting continuous growth in an evolving global landscape. By bringing together the strength, experience, and potential of Indian professionals worldwide, we aim to create lasting impact that goes beyond borders. Together we learn. Together we grow. Together we lead. Join us in building a stronger, smarter, and more connected professional community for generations to come.
Dr. Sharik, can you hear me, Dr. Sharik? Dr. Sharik?
Hello, am I audible?
Yeah, please go ahead.
Can you hear me?
Yeah.
Sorry, the wrong mic was on. Okay. Good afternoon, good evening, and assalamu alaikum. I am Dr. Sharik, your host for this webinar. On behalf of the International Indian Professionals Association, it gives me immense pleasure to welcome all our viewers joining us live on Zoom and YouTube from different parts of the world. At IIPA, we believe that knowledge becomes truly meaningful only when it empowers people to make informed decisions and improve lives. Through our series of educational webinars, we strive to bring experts from diverse fields closer to our community so that scientific knowledge can be translated into practical wisdom for everyday life. Today's topic is one that deserves far more attention than it usually receives. Hidden signs, serious risks. What every parent should know about urinary tract infections in children. Many people think a urinary tract infection is a simple illness that can be treated with a few days of antibiotics. However, in children, the story can be very different. A urinary tract infection may present with subtle or unusual symptoms, sometimes just fever, poor feeding, irritability, vomiting, or failure to thrive. If these warning signs are mixed or ignored, repeated infections can silently damage the kidneys, leading to long-term complications such as hypertension, reduced kidney function, and even chronic kidney disease. The encouraging news is that most of these complications are preventable through early recognition, timely medical evaluation, appropriate treatment, and regular follow-up when required. When you are a parent, an educator, a medical student, or simply someone who cares about children's health, today's session will equip you with practical knowledge to recognize early symptoms, understand risk factors, know when to seek medical attention, and learn how simple preventive measures can protect a child's kidneys for life. We encourage everyone to stay engaged throughout the session, take notes, and post your questions in the chat. We will have an interactive Q&A session towards the end where our expert speaker will be happy to address your queries. As the saying goes, awareness is the first step towards prevention, and prevention is always better than cure. With that, it is now my privilege to introduce our distinguished guest speaker, Dr. Mohammed Bilal Kaladgi, who will guide us through this important and highly relevant topic. A little bit about our doctor. Dr. Kaladgi is an assistant professor of pediatric nephrology at STM Medical College, Dharwad, and a consultant pediatric nephrologist dedicated to improving the kidney health of children through compassionate, evidence-based care. He completed his MBBS from Bidar Institute of Medical Sciences, MD in Pediatrics from SDM Medical College, and went on to pursue a super specialty DM in Pediatric Nephrology from the prestigious St. John's Medical College, Bangalore. His expertise spans the entire spectrum of pediatric kidney care, including urinary tract infections, acute and chronic kidney diseases, pediatric dialysis, kidney transplantation, neonatal nephrology, genetic kidney disorders, and pediatric hypertension. He has also been involved in several landmark clinical achievements, including performing one of the youngest renal biopsies and pioneering neonatal CRRT procedures during his training. Beyond clinical excellence, Dr. Kaladgi is deeply involved in medical education and clinical research. He has presented scientific papers at national and international conferences and has been an invited speaker on topics related to pediatric urinary tract infections and kidney transplantation. Today, he will be sharing practical evidence-based insights on a topic that concerns every patient. Again, hidden signs, serious risks. What every parent should know about urinary tract infections in children. I'm sure his expertise will help us recognize the early warning signs, understand when to seek medical attention, and learn how timely intervention can prevent serious kidney complications in children. For those who wish to stay connected and receive regular updates about our future programs, we will be sharing links to our official groups in the chat box shortly. We also highly value your suggestions and feedback as they help us improve and bring more meaningful initiatives to you. Ladies and gentlemen, thank you for being a part of this session. Let us begin this journey of learning together. Please join me in extending a warm welcome to Dr. Mohammed Bilal Kaladgi. Dr. Bilal, we are honored to have you with us today. The virtual floor is yours, sir.
You are on mute, Dr. Bilal.
Walaikum assalam. Thank you for all for giving me an opportunity to share one of the simplest and one of the easiest topic, but it plays a very major role in as a parental education for the prevention of the further consequences what we commonly seen in any of the patients who comes. Uh, so without wasting the time, since we were about to start at around 6:30 as Indian Standard Time, we are late. So I hope so we can we go ahead with continuing the topic. Hello.
Yeah, she's sharing the screen. It's visible to you?
Yes.
Okay.
So today's topic is hidden. 2 minutes. No. Huh. So today the basic topic what I have chosen is the common thing is what a parent should understand about a childhood urinary tract infection. What are the hidden signs and when do they have to consider as a serious one to consider that the child has to be approached for a UTI per se. So that is what as a common as well once we come across as a specialist in a pediatric nephrologist, what we see is out of 10 patients there is a 2 to 3 patients who presents with having a urinary tract infection of all the age group. So it is very important to know how to identify the common signs and when to diagnose, when to understand that these are the matters which is found to be a serious one, and when it has to be referred to a doctor to start the treatment per se. So can you change the first? Can you turn to the first slide, sir?
Azmat bhai, next.
Uh, can you see my screen, Dr. Sir?
Yeah.
I
The
can
first
see.
slide?
Azmat bhai, next slide, please.
Next slide.
Okay.
No, you have to go to presentation mode. You see
And
this?
enable editing and so that you can move.
Yeah.
Okay. Just one. Sir, let me know if you're able to see my screen.
You have come to the.
Go back to the first slide and then go.
Okay. Is this fine?
You're on mute, doctor.
Dr. Bilal, is this fine?
Fine.
Okay.
The most common presentation a child who present to any OPD or a clinic will be having a presenting as a fever. Fever is called as an alarming thing to identify the child has some abnormality with respect to his organ system. In that fever, you have to differentiate whether this fever belongs to the kidney related or a non-kidney related. For example, if any child who has presented to your OPD or at home presenting only a fever on day 1, on day 2, without any focus in the form of the child might have fever without any having a cold, without a cough, without having any acute gastroenteritis, without any having any features of rashes or anything, only presenting of fever for minimum more than 2 to 3 days, that is an alarming sign that suggesting that there is some abnormality with respect to your kidney, urinary tract, bladder. So it is just telling that it is just like a in a house. If you want to enter, the first entry point is a door. In the similar analogy, for a child who has some abnormality or any infection with respect to this kidney, urinary bladder tract, the most common presentation we across seen as a fever. So we should never ignore a fever a child who presents with. Uh, so this is an early marker for a diagnosing of a urinary tract infection in a children. Next slide. So now the point comes, what is a urinary tract infection? It's an infection which occurs in the whole of the urinary tract. So what is it? What is it called as a urinary tract? The urinary tract starts from the kidney, it ends to the urethra. When we can see in the right side of the image, you can see the two kidneys which is being supplied by the two form of a blood vessels, red color and blue. That is nothing but the artery and the vein which supplies to the two kidneys. And the kidney's function is to filter whatever the blood, and it forms a urine which is being excreted. So it being excreted from the kidney to the bladder with the help of a small passage like tubes, what we call it as ureter. From the ureter, it goes to the bladder. Bladder act as a storage system. From the bladder, it passes out from the urethra. So it starts from the kidney till the terminal point of expulsion of the urine. That is nothing but your urethra. Any point of infection starting from the kidney till the point of the urethra is considered as a urinary tract infection. So that is what it means. Why it is important? A kidney infection can permanently damage the kidney if it is not being treated or it is being delayed. So in this point, you have to early detect and proper treatment protects little kidneys for healthy future. So this slide says about the exact what does happens in a urinary tract infection per se. Can you change the next slide, please? Which are the children who are having a risk factors for causing a urinary tract infection in a children? So means it is indirectly saying that which are the children who are prone to get an urinary tract infection. The most common is poor toilet hygiene. For example, they are not cleaning their genitals properly post defecation, post passing of their urine. Wiping, and another most common what we see is wiping from back to front or unclean habits can also add up to the increased risk of urinary tract infection. The second, actually, this is a most common what we see is a constipation. That is what we say as urinary bladder as well as the rectum which stores the stool act like as a brother and sister. If one gets affected, other also gets affected. For example, if the child is not able to pass the stool properly, it starts compressing over the bladder, and this causes failure of incomplete evacuation of the bladder. Because of this incomplete evacuation, whole of the urine gets accumulated, and that act as a risk for getting a urinary tract infection. So always we have to identify whether the child is suffering from any constipation per se. We usually in a local language what we can say is whether the number of the frequency of the episodes of the passage of the stool has been decreased. Is it like asking, telling a history that a child can pass only 2 days once, 3 days once, or if he passes daily, is that the stool is is it's a normal or abnormal in the form of if the child strains while passing passage of the stool in the form of a pellets or in a form of a hard defecation, that itself says that it's a constipation. So always we have to ask any risk factors of a constipation, which is itself a risk factor for your UTIs. The third most common what we see is holding of the urine. Means the child wants to postpone the urine. For example, if the child is involved in some activities, for example, a child has been playing or child has been watching some during the screening time. If the child has seen was very much busy, he don't wants to miss that scenes in the subsequent phase. He wants to postpone it. That postponing of the urine itself also can add up the risk factors. And we especially we commonly see in a school going children when they attend for the schools during the class, when the child wants to go for the passing, when the child asks for the asking the teacher to pass for the allowing her he or she to pass the urine, they refuse. In this such conditions, they try to hold the urine, and that adds up into the one of the risk factors for causing of urine. And another most common what we see is decreased oral intake, which is also adding up into increased risk. The the other one differential is having any abnormality with respect to of urinary tract, like having a kidneys being swelled, the ureter, the tubes which has been connecting from the kidney to the bladder is been become very much big and it is very enlarged, or a bladder has some abnormalities, then this also add up to the increased risk of urinary tract infection. The one of the least most common causes any form of these stones that is obstructing the pathway of the urinary tract, that can also act as a one of the risk factor for causing of urinary tract infection. So if any child who have a fever, so we have to look into these are the risk factors which can add up to increased risk of UTI in a children in the form of constipation, postponing of the urine like holding of the urine, low water intake, or having poor toilet hygiene and increased risk, and also the adding up of the risk factor of kidney stones. So always good habits today, healthy kidneys tomorrow. The second thing is these are the just predisposing factor. When a baby presenting with only a fever, how does the how we can suspect that this child is going for having a urinary tract infection? So we divide the symptoms based on the what we call it as a pre-verbal or verbal. Pre-verbal means the children not able to convey anything through the verbal forms. So we have to detect the child is having any form of UTI based on the symptoms, based on the whatever the child is presenting in the form of fever without any focus of infection like cold or cough, or the child started refusing and leading into a poor feeding, or the child is vomiting very severely, or the child is very irritable. And we have to, because of these recurrent episodes of UTI, the child will have poor weight gain, poor height, and they go for what we terminology call as a failure to thrive. And some of the newborn babies, they can also present with jaundice in the newborns. So these are the very early signs which a mother or a father has to able to detect these signs and has to be consulted to a doctor. Then when you come to the verbal forms, like children who are very older age, like more than 5 years, they present with more of a localized signs with respect to the urinary tract system, like in the form of burning micturition or increased number of the frequency of the passing of the micturition, or in the form of urgency. Urgency means by the time they go to the washroom, they have incontinence. Some of them have a history of wetting of the pants by the time they reach to the point of the bathroom. And even the if the fever and the symptoms of the frequent urination, if it is severe, and they can go for a severe abdominal pain. And some of them also present with blood in the urine. And the most common which many parents ignore is that the child is doing fine, nothing, but they have, when we dig a history, they says that the child is not yet dry by night, so he or she still passes the urine in the bed. So that itself is also adding up into an important risk factor or as one of the symptom for UTI. So early recognition and treatment of UTI prevents further kidney infection and further complications. So if you have identified a child having all those symptoms, you can consider as having a UTI. But as a parent, as a responsibility parent, you have to be also aware some of the important signs which make you to understand these are the red flag signs. We should not wait for the progression. So these are the very immediate thing which we, if these signs are there, we should rush to the hospital. Like high fever which is not settling down even after 3 days, 4 days, then you should not wait, you have to consult to the doctor. So identifying a high grade fever which is persistent for more than 2 to 3 days, or persistent vomiting. Because of the persistent vomiting, the child is losing a form of a strength. He becomes very drowsy, lethargic, not able to communicate, not able to take any form of liquids or a food. Then that also adds up into a danger sign that the child has to be consulted to the hospital as early. And based on these features, the child will go into, child looks very, very, very sick. And along with that, because of the severe vomiting and the refusal of the oral intake, this will add up into a decrease in the volume status in the body, which adds up into a decreased urine output. So many of them will say, as the baby has passed only once in a day. That also is one of the danger signs that the child has to be consulted. And complaining of severe abdominal pain or a back pain, which we call it as an infection of the kidneys. That is what we, medical terminology, we call it as pyelonephritis, which is also an emergency thing which has to be consulted, which should not be delayed. And any baby which is less than 3 months with any form of the symptoms which I have posted in the previous slides, that has to be treated as well as addressed as early as possible. So these are the red flag signs that a parent should understand and has to be consulted as early as possible when they see these signs. So a parent has to educate themselves that when a when the child has been told that the child is been suffering from a urinary tract infection, many of the doctors, they tell take a urine sample and send it for the investigation. But what we miss as a doctor is the educating the parents that how to collect the urine. Whenever when we advise for collection of the urine, we should always ensure that the parents has to clean the he or she's child's genitals with a water. And we have to use a sterile container. And when we are about to collect the urine, we have to make sure that we collect the midstream of the urine rather than collecting the initial stream of the urine. Because the collecting of the initial stream of the urine will have high risk of contamination of the urine. So it is advised to collect from the midstream of the urine. So that identification of the urine will help us to know whether this child is suffering from UTI. And whatever the urine sample which has been there, again we run it for a culture of the specific organism. That will take another 2 days. So exactly knowing the status of the urine in the form of a urine routine and the urine culture, we can decide the specific antibiotics. However, some patients of a UTI can also require some additional test in the form of getting a basic, what we call it as ultrasonography of the kidney and the bladder. Whereas in still more rare cases, we want to get still more to know exactly why the child is suffering from this UTI. What we do is a MCU, that is nothing but the micturating cystourethrogram. to know exactly any urine is going from the bladder to the upper ureters or to the back of the kidneys. It's just what we call it as reversal of the urine. Instead of the urine coming from the kidney to the bladder and exiting out, it goes in the reverse form to know exactly whether there is a reversal of the urine, which can be detected with a simple investigation, what we call it as MCU. In the later phase, if the kidney gets infected repeatedly, it forms a scar. That scar can be detected with another scan, that is what we call it as DMS scan. As a parent, what is important is how to collect the method of collection of a urine sample and what is the importance of it, so that we can decide about respective antibiotics. Accurate diagnosis helps in right treatment and protects your child's kidney. What is the importance of collecting a urine culture? Because it identifies the specific organism, means why the child is suffering. Is it because of the bacteria? Which type of bacteria? We have multiple organisms. That is what we call. We have what we usually call as E. coli, Klebsiella, Pseudomonas. These are the some of the bacteria which we call. It will be in the form of a round shape or in the tubular shape. Based on that, so identifying the bacteria will help us to diagnose the disease, and based on that bacteria, we choose the specific antibiotic, and this also help us to prevent the antibiotic resistance. So parents should collect the urine before giving any antibiotics. This is always we have to ensure before giving a, if the doctor has prescribed any medication with respect to the UTI, urine infection, first you have to collect the urine sample, then only you have to consider that prescription. Not after taking the antibiotics. If you collect the urine sample, there is a high risk of getting your urine culture negative. Next point comes the treatment percent. Treatment depends upon the age and the severity. Normally, usually we includes antibiotics that will kill the organism. And along with that, supportive measures has to be taken in the form of taking plenty of the fluids. And in order to, because of the high grade fever, we have to use some amount of the what you call antipyretics, in the form of which is commonly used. We call it as paracetamol. And when a parent should be getting worried that this child is not being treated at home, it has to be transferred to the hospital. That is what we call hospital inpatient. Where if it is a very young baby that is less than 3 months, if the child is persistently vomiting and getting dehydrated in such conditions, if what we commonly call as a pyelonephritis, if the infection has gone up to the size of the kidneys, at the level of the kidneys, which is very severe abdominal pain, in such cases we need IV antibiotics. If the child is very sick and not able to take any orally, in such conditions also we need a hospital administration. So it is says that early treatment leads to quick recovery and prevents complication. So now we have gone through child having a UTI, how to diagnose it, how to treat it. Now the thing is, after first episode of any having a child having a UTI, we don't want the subsequent episodes to get again UTI. So how do a parents is can prevent these episodes of UTI? One is small habits, big protection. That is drinking plenty of water, which flush all the organisms. Do not postponing of the urine in the form of crisscross or any other forms. And always we are in ignorance of ignoring the constipation that has to be treated. Proper toilet hygiene, and in the girls, wipe front to the back or changing diapers frequently. Good habits today, healthy kidneys tomorrow. uh, so many of the parents, like, they will be worried, if we don't treat, what will happen? How does it have its natural prognosis? If we don't treat, what will it leads to? So usually, if because of the infection, it causes UTI. If these episodes occur repeatedly, then it has effect on the kidney. What we call it as like a kidney scarring, means damaging of the filtering of the units of the kidney. Because of this scarring, it further lands up into a increase in blood pressure. So some of the children's, even we have a kid of 3 months, 6 months having a hypertension. And since the kidney plays a very important role in expelling all the waste metabolites, and this, because of the failure of the functioning of this kidney, because of the recurrent episodes of infection, this metabolites gets accumulated. This inhibits the growth of the child, and this leads to a poor kidney growth, as well as what we call even the normal growth of the child has also been hampered. And this will land up into this child into a chronic kidney disease, from a UTI to a acute kidney injury, which goes to a chronic kidney disease. So we should never ignore a child having a UTI. So early treatment prevent these all complications. Next slide, please. As many parents have some myths, like myth in the form of only girls getting urinary tract infection. No, boys and girls both gets affected. But what we see is almost like more than 5 years or 7 years of age group, the females are more getting affected than the males. Then is that myth is like no burning micturition, no UTI? No. I mean, some of them presents without a burning micturition. So small babies may only have only fever. That is what we have seen in the previous slides. Myth is like antibiotics should stop once the child improves. No. Once the child getting and having a urinary tract infection, it has to be treated completely. So a child has to complete its course of antibiotics in the form of 5 days or a 7 days based on the type of infection it is the child is carrying. So right knowledge, early care, healthy kidneys is a happy child. So this is what together let's protect our children's kidney and give a healthier tomorrow. Your awareness today is their healthy future tomorrow.